voices weren't just in my head. They were a cacophony of misdirection. Shadows shifted, hinting at a reality I couldn't comprehend.
My reality was blurring, and every day felt like walking through a maze with ever-shifting walls.
Mental health alarms. Early signs of schizophrenia. Schizophrenia affects millions worldwide, casting a haze over their perceptions and transforming their lives. Understanding the early signs is crucial, not just for those living with it, but for the communities that surround them. With the World Health Organization estimating that over 20 million people suffer from schizophrenia globally, it's clear that this disorder is far more prevalent than most realize. Its onset, often insidious, starts predominantly in late adolescence or early adulthood. This crucial developmental period, when most are navigating the complexities of establishing an identity, career, or relationships, becomes exponentially more challenging with schizophrenia in the picture. Schizophrenia doesn't just affect the individual diagnosed with the condition. Families bear the brunt of the emotional, financial, and sometimes even physical strain. Educators, too, find themselves at a crossroads, witnessing the transformation of a promising student into someone who may struggle with tasks that once came effortlessly. Society at large remains largely misinformed about schizophrenia, resulting in stigmatization and isolation for those afflicted. The early signs of schizophrenia can be subtle, sometimes mistaken for typical teenage behavior, or written off as eccentricities. Yet, timely detection can be life-altering. While this disorder may manifest differently across individuals, understanding its early signs is a shared responsibility. Aaron Carter, the late heartthrob singer who graced many a teenage wall in the late 90s and early 2000s, found himself under different spotlight as an adult. In the midst of a promising career, with millions of records sold before the age of 15, Carter's later years were marked by a series of personal and public struggles that shone a light on mental health, particularly schizophrenia. In the mid-2010s, Carter's behavior began to attract attention, but not for the usual celebrity reasons. Multiple erratic public appearances, coupled with legal troubles and disputes, pushed him to publicly address his challenges. In a candid 2019 interview on The Doctors, Carter revealed that he had been diagnosed with multiple personality disorder, schizophrenia, acute anxiety, and manic depression. The early signs of his struggle can be traced back to his late teens and early 20s. The pressure of fame, the public scrutiny, and the intense lifestyle could very well have exacerbated his symptoms. Often, early adult life, particularly between ages 16 and 30, is when the onset of schizophrenia symptoms is most prevalent.
Disclaimer. This video is intended for educational purposes only, and is not a substitute for professional medical advice, diagnosis, or treatment. Let's now continue our journey to better understand mental health.
This narrative also underscores the importance of understanding and empathy. Behind the headlines was a person grappling with a severe mental health condition, trying to find his footing amidst a whirlwind of public and personal pressures. Numerous studies have focused on the genetic aspects of schizophrenia. The National Institute of Mental Health, or NIM, reported that individuals with a first-degree relative with schizophrenia have a 10% higher likelihood of developing the disorder, compared to the 1% risk in the general population. However, it's essential to note that while genetics play a role, the majority of people with schizophrenia have no family history of the disorder. This emphasizes the multifaceted nature of its onset. A groundbreaking 2011 study published in Nature Neuroscience found that individuals with schizophrenia often have unique patterns of brain abnormalities. This was a significant step towards early detection, potentially allowing for interventions even before the onset of full-blown symptoms. However, a significant gap remains in our understanding of environmental triggers. While there's consensus that traumatic experiences, substance abuse, and early parental loss might increase the risk of developing schizophrenia, quantifying this risk remains challenging. A 2014 study in Schizophrenia Bulletin highlighted the complex interplay between genetics and environment, suggesting that certain genetic factors might increase one's vulnerability to environmental triggers. However, much more research is required to decode this intricate dance between nature and nurture. The approach towards treatment has also witnessed shifts based on emerging research. Antipsychotic medications remain the cornerstone of treatment. Yet, a 2017 study in the American Journal of Psychiatry revealed that combining these medications with psychosocial therapy, particularly in the early stages of the disorder, resulted in significantly better outcomes for the patient. Despite these advances, a glaring gap remains: public perception and stigma. While the medical community pushes boundaries in understanding and treating schizophrenia, societal misconceptions persist. A survey conducted by Schizophrenia and Related Disorders Alliance of America in 2019 revealed that over 50% of respondents associated schizophrenia with violent behavior, a stereotype that numerous studies have debunked. While personal testimonies like Aaron Carter's provide a visceral understanding of the lived experience of schizophrenia, it's imperative to delve into the medical and psychological facets to grasp the full spectrum of this disorder. What are the subtypes of schizophrenia? 1. Paranoid schizophrenia. The most commonly diagnosed type. Individuals with this form often have intense delusions or auditory hallucinations, but might maintain cognitive functions and emotions. They might hear voices that others don't, or believe that external forces are controlling their thoughts, leading to severe distrust. 2. Disorganized schizophrenia. Here disorganized thinking is paramount. It can lead to challenges in daily tasks, like organizing one's thoughts or connecting them logically. Speech might be impaired, and emotional responses might seem inappropriate or blunted. 3. Catatonic schizophrenia. This type manifests in reduced movement, from resistance to instructions to complete lack of activity. On the flip side, individuals might also display purposeless movements, like repeating what others say or do. 4. Undifferentiated schizophrenia. As the name suggests, this type embodies symptoms that don't neatly fit into the above categories. Symptoms could be a mix of various forms. 5. Residual schizophrenia. Here the person might not experience the full-blown symptoms of schizophrenia, but may have less intense symptoms that linger. Schizophrenia symptoms are generally classified into 3 categories. Positive symptoms, like hallucinations, delusions, and thought disorders. Negative symptoms, such as reduced feelings of pleasure, reduced speaking, and diminished ability to begin and sustain activities. And cognitive symptoms, which might be subtle for some but can be debilitating for others. These can include impaired executive function, or the ability to understand information and make decisions, difficulty focusing, and issues with working memory. There's hope in the form of multiple treatment modalities, bringing solace to countless individuals and families. These treatments don't promise a cure, but significantly alleviate symptoms and enhance the quality of life. 1. Medications. As to antipsychotic, stimulants, and non-stimulants. 2. Behavior therapy. Cognitive behavioral therapy, or CBT, is notably effective. It assists patients in recognizing and altering harmful or inaccurate thinking patterns. 3. Supportive therapies. By engaging the patient's family, they can understand the disorder better and learn strategies to support their loved one. while vocational rehabilitation and supported employment programs can assist individuals in returning to the workforce or school. 4. Hospitalization. At times, severe episodes might necessitate hospitalization. This ensures the safety of the individual and provides a stable environment for crisis intervention. 5. Electroconvulsive therapy or ECT. While not a primary mode of treatment, ECT can be effective for those who haven't responded to standard therapies. As we tread this explorative journey of schizophrenia, it becomes paramount to encapsulate our findings with actionable recommendations and a hopeful conclusion. Here are some recommendations. 1. Early intervention. The Schizophrenia International Research Society highlights that timely diagnosis and treatment can substantially improve outcomes for the affected individual, often resulting in milder symptoms and better overall functionality. 2. Community support. Whether it's through local community groups, support groups, or online forums, connecting with others on a similar journey can offer invaluable insight and reassurance. 3. Continuous education. And 4. Promote mental health. Our expedition into the realm of schizophrenia isn't just about understanding a medical condition. It's about embracing the human spirit's resilience and potential. Take the words of Ellen Sachs, a professor, lawyer, and psychiatric expert who herself has schizophrenia. My good fortune is not that I've recovered from mental illness. I have not. Nor will I ever. My good fortune lies in having found my life. Let it serve as a testament to the tenacity of those with schizophrenia, and the unwavering support of their families, educators, and well-wishers.